When the odds are stacked, building resilience through community and connection. Have you ever looked at a situation and thought, the deck is completely stacked against me? That moment when you realize the game wasn't designed for you to win, when the statistics, the history, the unwritten rules, everything seems engineered to ensure your failure. Today, I had the extraordinary privilege of interviewing Leah Kelley, whose revolutionary work has transformed how we understand resilience in the face of seemingly insurmountable barriers. Leah isn't just a researcher or advocate. She's a visionary who has mapped pathways to success for Black professionals navigating systems that were never built with them in mind. Her brilliance lies not just in identifying problems, but in illuminating solutions that have already changed thousands of lives. The ripple effects of her work will be felt for generations. Now, imagine feeling that weight not just occasionally, but systematically, day after day, in boardrooms, in academia, in healthcare settings, in spaces where your very presence is sometimes treated as an anomaly. This is the reality for countless Black professionals across America. But here's what my conversation with Leah revealed: the odds may be stacked, but they are not immovable. The truth about resilience, that quality we so often mythologize, is that it isn't something you're born with. It's not encoded in your DNA or bestowed upon a lucky few. As Leah emphasized throughout our discussion, resilience is a learned skill cultivated through intentional strategy, self reflection, and perhaps most importantly, community. Let me share what Dr. Nathan Connolly discovered at Johns Hopkins University. As a Black faculty member, he faced exclusion within academic circles and navigated structural barriers that limited representation. The odds were stacked high against meaningful change. But Dr. Connolly didn't just accept these conditions. He co led Housing Our Story, an oral history project capturing the experiences of Black staff. Think about that for a moment. He created space for voices that had been systematically silenced, turning personal narratives into powerful catalysts for institutional transformation. These weren't all just stories filed away in an archive. These oral histories fueled policy changes that improved workplace equity throughout Johns Hopkins. Dr. Connolly's work, deeply influenced by his partnership with his late wife, Shani Mott, who risked her own safety to demand justice within academia, set new standards for inclusion across higher education. What's remarkable here isn't just the outcome, but the method. Dr. Connolly understood something fundamental that Leah Kelley emphasized in our conversation: community matters deeply, profoundly. Sometimes it's everything. The poet Audre Lorde wasn't being metaphorical when she wrote, "Without community, there is no liberation." She was describing a practical reality that successful Black professionals have long understood. When the odds are stacked against you, individual brilliance is rarely enough. You need trusted relationships. You need culturally relevant support systems. You need mentorship networks that provide both practical guidance and emotional encouragement. This brings me to another powerful example Leah shared. In cities across America, community leaders implemented culturally relevant interventions to address cardiometabolic disparities among Black men. The challenges were daunting. Structural racism had led to deep mistrust in healthcare systems. Economic instability, housing insecurity, and discriminatory policies had exacerbated chronic disease risks. The solution wasn't found in traditional medical approaches. Instead, these leaders engaged trusted local figures as health ambassadors. They prioritized cultural humility training over conventional bias training among providers. They invested in place based solutions addressing social determinants like housing and neighborhood resources. The results: improved patient provider Trust led to better engagement with preventive care services. Increased workforce diversity began changing institutional culture around care delivery. These community partnerships between clinics and local organizations aligned with residents' actual needs, not just institutional agendas. This model is now cited nationally as evidence that overcoming systemic odds requires both internal resilience and external reform. As Maya Angelou wisely noted, you may encounter many defeats, but you mustn't be defeated. These communities refuse defeat by reimagining what healthcare could look like when designed with them, not just for them. But let's be honest about something that often gets overlooked in conversations about resilience and success. Mental health is foundational to achievement, yet it remains stigmatized, particularly in communities of color. Leah Kelley's research revealed that nearly 88% of entrepreneurs struggle with mental health issues, with unique burdens on those from marginalized backgrounds due to stigma or lack of accessible support networks. Black founders often face compounded stressors, financial uncertainty plus racial discrimination, which increase rates of anxiety or depression compared even to other entrepreneurs. Here's what's fascinating. Female entrepreneurs were more likely than males across all backgrounds to seek out robust support systems, including affinity groups focused on empathy rather than competition. Entrepreneurs who built intentional communities around shared experience reported greater resilience during downturns and were more likely both to persist through challenges and reach out proactively when struggling. The conversation about founder mental health has only recently become mainstream, in part because trailblazers have been willing to publicly share stories about surviving burnout or breakdowns while building successful ventures. This increased dialogue has led some accelerators and incubators, specifically serving minority founders, to now embed wellness resources into their programs, from therapy stipends to peer coaching circles. This redefines what it means to win as an entrepreneur, not just business growth, but holistic well being despite daunting odds. As Audre Lorde also reminded us, caring for myself is not self indulgence, it is self preservation. And that is an act of political warfare. For Black professionals facing systemic barriers, prioritizing mental wellness through therapy, community engagement, or cultural humility practices isn't optional. It's crucial for long term achievement. I want to pause here and acknowledge something important. When we talk about overcoming odds, there's often a dangerous narrative lurking beneath the surface. The myth of the exceptional individual who, through sheer force of will, overcomes systemic barriers. This narrative places the burden of change entirely on individuals rather than addressing the systems that create those barriers in the first place. What Leah Kelley's research shows is that true resilience isn't about exceptional individuals, it's about exceptional communities. It's about creating networks of support that make success not just possible, but sustainable. It's about recognizing that while individual determination matters, collective action transforms systems. This is why Dr. Connolly's work at Johns Hopkins was so powerful. He didn't just succeed individually, he created pathways for others. The community health initiatives didn't just help a few patients, they changed how healthcare is delivered. The mental health advocacy among Black entrepreneurs isn't just about individual wellness, it's about redefining success itself. As Bell Hooks wrote, rarely, if ever, are any of us healed in isolation. Healing is an act of communion. This wisdom applies equally to professional success. Rarely, if ever, do we succeed in isolation. Success, too, is an act of communion. So, what does this mean for you? What actionable steps can you take from Leah Kelley's insights? First, recognize that resilience is a skill you can develop. It's not about never falling, it's about learning how to rise. It's about seeking support, building community, and continuously learning from adversity. Second, invest in community. Identify mentors who understand your journey. Find peer networks that provide both challenge and support. Create spaces where authentic connection can flourish. Remember that in a world that often isolates us, building community is itself an act of resistance. Third, prioritize your mental health. The unique stressors facing Black professionals, including discrimination, social determinants of health, and underrepresentation in leadership roles, take a real toll. Therapy, community engagement, mindfulness practices, these aren't luxuries. They're essential foundations for sustainable success. I want to challenge you today. Identify one area where you feel the odds are stacked against you, whether it's access, representation, funding, or well being, and take one concrete step toward seeking help or building community around it. Reach out for mentorship, join a supportive network, start a conversation about mental health in your professional circles. Remember that progress starts small, but builds momentum through connection. The stories Leah Kelley shared with me of Dr. Connolly transforming academic institutions, of community health initiatives, reimagining care, of entrepreneurs redefining success. These aren't just inspiring anecdotes, they're roadmaps. They show us that even when the odds seem insurmountable, collective action creates new possibilities. Let me leave you with this. We live in a world that glorifies the lone hero, the solitary genius, the individual who made it against all odds. But that narrative isn't just incomplete, it's dangerous. It obscures the communities that make transformation possible. It hides the networks of care that sustain us when systems fail. It erases the collective wisdom that guides us when maps don't exist. The deck may be stacked, but you are not playing alone. And when we play together, when we share strategies, when we pool resources, when we lift as we climb, we don't just beat the odds, we change the game entirely. Your resilience isn't just about your personal success. It's about creating ripples that transform systems. It's about building bridges where others see only walls. It's about recognizing that your story, with all its struggles and triumphs, isn't just yours alone. It's part of a larger narrative of a collective liberation. So I ask you, how will you build community today? How will you reach out to those who need connection? How will you transform your personal resilience into collective power? Because when the odds are stacked against us, our greatest weapon isn't individual excellence, it's the revolutionary power of community and connection. The world doesn't just need your success, it needs your solidarity, it needs your story, it needs your commitment to ensuring that no one faces impossible odds alone. That's how we truly change the game, not by playing it better, but by rewriting the rules together.